Welcome back. You know, there's been an increase in awareness about celiac disease in our community and across the country, but what is celiac disease? And with us this afternoon is our very own Hutyra, who knows firsthand what it's like to have celiac disease. Thank you so much for being with us here this afternoon.
You're welcome. I know a lot of people might be saying, well, what's she doing here to talk about this? Well, I myself was diagnosed a little over 4 years ago, and I had never heard about celiac disease when I got my diagnosis, so it was a huge learning experience for me. And you know, doing what we do for a living, we research. I mean, that's what we do when we're not on camera.
Exactly.
So that became my life, really, was researching celiac disease, because I had to understand what it was that I was going to have to deal with for the rest of my life.
It can be a little tricky when it comes to, you know, one person's lifestyle and things like that. It can definitely change your entire life, and I think that's what happened for you.
It does. And you know what celiac disease is? It involves gluten. Everybody hears about gluten-free diets nowadays, and a lot of people have the misconception that it's this health diet to lose weight and it's this big fad. But for people with celiac disease, we have to eat gluten-free just to live. If we want to live a healthy life and we want to not be sick all the time, we have to eat gluten-free 100%. So I had to research what that meant for me, and I had to look at what I had to change about my life. Gluten is found in wheat, rye, and barley. So think about that for a minute.
Exactly.
Everything contains wheat, rye, or barley, because what's happened to wheat? Well, it's ground up into flour. It's used in bread, cookies, cakes, cereal, you name it, it contains gluten. And gluten is even in things that we don't eat. Play-Doh, our kids play with Play-Doh. It's made with wheat.
I didn't even think of that.
Adhesive on envelopes. I have to be careful about going to lick an envelope because that contains gluten. So when you're diagnosed as a celiac, you really have to look at every area of your life and say, where is gluten and how do I avoid this?
How can people, I guess, what are the first symptoms, you know, that people need to be looking out for to see if they do necessarily have celiac disease?
Well, you know, celiac disease is nothing new. It's been around for decades, but there's a lot more research happening on celiac disease. The misconception has always been that it's strictly intestinal, that you'll have, you know, stomach pain, vomiting, diarrhea, those types of things. But doctors and researchers are now finding that a vast majority of people with celiac disease don't have those symptoms. In fact, those weren't my major symptoms. My symptom was this horrible skin rash that just would not go away, and it itched like crazy for months and months and months. Also neurological symptoms. I always felt like, they call it brain fog. I always felt like I couldn't remember things, or I always felt like I was in a cloud. And also I had weird things like sneezing every time I ate something with wheat, which I never put all of these things together. Low iron levels was something, you know, I had times where I was turned away donating blood because my iron was always low, even when I tried to supplement with iron. Migraines for women, fertility issues, there are more than 300 symptoms associated with celiac disease, so it's different for every single person.
So in order for someone to know maybe they have some of these symptoms, you know, or they're curious, maybe they have it. It is a gene, but you can get tested, correct?
That's right. It is genetic, so you're born with it.
Exactly.
And there's a genetic test that you can do that will tell you whether or not you have the genes. And just because you have the genes doesn't mean that you have active celiac disease. For me, you know, obviously I was born with the genes, but I think through childhood it wasn't really active. Sometime, I think I estimated in my 20s it started becoming active and then became full-blown active, you know, after I had my daughter. So it's different. There is a blood test that you can have done that tests for what are called antibodies in your blood. When a person with celiac eats gluten, an immune response happens in their body. Their body starts kind of going crazy, and your immune system attacking itself. So what this blood test does is it tests for those immune antibodies that will tell you if your body is having a reaction to gluten.
All right, Anna is going to be right back because, you know, we've talked about the gluten-free diet, but she has some great tips if you do have celiac disease, and you're going to talk about some of that